Our show has been closely tracking the devastating aftermath of the Supreme Court's Dobbs decision, which overturned the constitutional right to an abortion. We've brought you story after story of women who've suffered and even died preventable deaths because abortion is health care, and that health care was delayed or denied under draconian post-Roe anti-abortion regimes in America. We've talked to and about women who've been denied care during life-threatening miscarriages and even postpartum care after delivering healthy babies because of abortion bans. But it's just as important that we talk about the majority of women who seek an abortion in this country, those facing unintended pregnancies. For them, abortion is also health care. The alternative to women in consultation with their families and doctors being able to choose an abortion is forced birth, which is literally a human rights violation, according to Amnesty International and the United Nations, among others. The dissenting judges in Dobbs warned about the impact of criminalizing abortion. They described overturning Roe as depriving women of the ability, quote, to participate equally in this nation's economic and social life, end quote. They warned that women would incur the cost of losing control of their lives. Well, my next guest, Sarah Harrison, understands this firsthand. She had 2 abortions, nearly a decade apart, and she writes in the New York Times that, quote, both of my abortions were necessary. Only one gets sympathy. I had my first abortion one day after I turned 28. I was a single mom to a 5-year-old daughter. We lived in a 1-bedroom basement apartment. I was a recent law school graduate studying for the bar exam, living off a loan and small scholarship. I knew I couldn't raise another child while being the mother I wanted to be for my daughter or while pursuing the career that I wanted in public service. It's the kind of story people tend to judge rather than champion. My second abortion was this past November. This time I was married and happily and intentionally pregnant. The only surprise was that it was twins. Now 37 years old, I had routine prenatal testing, which revealed that fetus B had trisomy 18, a fatal fetal anomaly. I knew that continuing this unviable pregnancy of fetus B would have put fetus A and me at a high risk of serious complications, including miscarriage, stillbirth, and preterm birth. My husband and I were heartbroken. We knew there was only one way to protect fetus A and myself, but we live in Texas, and because of our state's abortion ban, I had to travel to Colorado for abortion care. My 2 abortions were a decade apart and different in so many ways, but my choice to have them hinged on the same innate desire to exercise the freedom to determine my future. Both allowed me to care for my children, protect my health, and pursue my career in the way I determined was best. Joining me now is the author of that powerful piece, Sarah Elaine Harrison. She's an attorney based in Texas. Sarah, thank you for joining us this morning.
Thank you for having me.
In your article, you point out the lack of empathy for women who seek abortions outside of those who need them for medical emergencies. Talk to me about the misconceptions, having had 2 abortions under different circumstances, about people who obtain what we call elective abortions, abortion of their own choosing.
Yeah, I think one of the biggest misconceptions is that women do this in a carefree or cavalier way, while the decision to have abortion in reality can be quite difficult. It was for me in both situations, but we need to remember that we have to trust women and know and understand that they know what is best for them and that they don't have to justify why they are having an abortion. They know what they need. And so that's why I encourage all of us to destigmatize abortion care, because it is not a question for the rest of the world to judge. It is up to a woman to decide what is right for her.
It's a question that people judge in the abstract, but you're not the abstract. You're here. You've written about your specific choices that you made when you were 28 years old. Do you think your life and career would have taken a different path if you were not free to make that decision?
Yeah, I knew at the time that my life would have been fundamentally altered in a way that I wasn't ready for. As you just read, I was a single mother of a 5-year-old, and I was trying to pursue my career in public service, and I wouldn't have been able to do that and care for another child. But I think instead of walking through what ifs for individual cases like mine or anyone else's. It's that we should always focus on trusting that women know what's best for them, and it doesn't make sense for us to assess what their life would have been like or wouldn't have been like. It is up to women to decide what's right for them. And there are plenty of studies, so we can just look at data, right? Because there are plenty of studies that show the detrimental outcomes to women when there is not access to abortion care, like the studies that we're seeing across the country about rates of infant mortality or maternal mortality or forced travel, like in my case, and then all the stories of women who are not able to travel that we're not hearing about, who are either going through a forced pregnancy or managing abortions on their own. And so we have that data, and we know what the impacts are of abortion bans or hostile laws, laws that are hostile to abortion care. And so that is what we should work from and make our policies and build our policies and laws off of.
What was interesting in both of your cases, you write about the decision you made for yourself and to protect your family. Much of the rhetoric driving the anti-abortion movement is about protecting the American family. In fact, I'm sitting here next to my trusty copy of Project 2025, and it's all based around protecting the American family. It's some interesting rhetoric, given that both of your abortions were made with that in mind.
Yeah, you can start with the extreme, right? You can start with my case where I had to leave my state to seek medical care to protect another fetus, right? There was no exception in Texas law to protect a healthy fetus when another fetus was not compatible with life. And from there, it's a spectrum. But conservatives take such an extreme position on this issue that it's hard for anyone to take them seriously, that they support families. And as you just said, my decision to have an abortion in both cases was to support my family. It was a family-based system. I think abortion is a family values issue, and that is how I think Democrats are framing it as they continue to support reinstating Roe, and I think that's right. But I do agree it is not a protection of family values to deny women the right to the health care that they need.
Sarah, thank you for joining us, and thank you for telling your story. Sarah Elaine Harrison is an attorney based in Texas.